Number 4 for Deputy Louise O'Reilly. Minister, your response.
Thank you very much. Easing of restrictions on the employment of additional staff was announced by the last government in Budget 2015. Under this new approach, public sector organisations can obtain delegated sanction to recruit within the parameters of their pay budget once they obtain approval for their pay and number strategy from their parent department and from the Department of Public Expenditure and Reform. This change allows for greater autonomy to be delegated to departments and agencies to manage their own staffing levels within allocated pay frameworks. It also provides for further recruitment flexibility. For example, where it determines that offering permanent contracts can achieve more economical service delivery than agency usage, and this is something we see right across the health service. The HSE is currently working with the Department of Health on the finalisation of its 2016 pay and numbers strategy. This has involved the development of detailed workforce plans at hospital and community service levels, rather than just being told what the requirement is from the HSE head office. This has been a bottoms-up approach to what the recruitment requirements are. Meanwhile, though, the HSE has emphasised to service providers that they must operate within their pay budgets. This does not impact on a hospital's ability to recruit where funding exists to facilitate that recruitment. For example, in the case of funded replacement posts, or where additional funding has been allocated for new positions under the HSE service plan, the mental health area being one very important area in that regard. Recruitment can also take place in the health service in areas of critical care and in areas of emergency service, and I was pleased to be able to provide assurances to the INMO in that regard this week. The HSE has continuously increased staffing levels since the beginning of 2015. By the end of April this year, overall health service employee numbers had increased by over 6,000 whole-time equivalents since the start of last year, with an extra 1,600 whole-time equivalents in the first 4 months of 2016 alone. The vast majority of these employees are in frontline positions. Numbers in the medical and dental category increased by almost 600 whole-time equivalents, or 6.5% since the start of 2015, while the nursing figure rose by over 1,700, or 5% during the same time frame. Let me be very clear, the number of people working in the front line of our health service is increasing. It increased last year, it will increase this year, and under this government it will increase every year.
Thank you very much, Minister. Deputy.
Let me be clear, Minister, the activity in the health service is going up and the staffing levels aren't matching it. There is a recruitment pause in place. You can deny it if you like. I have it in writing here from the Office of the Assistant National Director of Oral Health. A temporary recruitment pause is in place pending the outcome of cost containment discussions. So there is a recruitment pause in place. There isn't a hospital or a health facility in the state that is staffed to adequate levels, and I don't think anyone will contradict me on that. Minister, are you aware of the spend on agency to date from January to April of this year? €68 million, 2,379 whole-time equivalents. Do I need to convince you that agency workers are less cost effective than directly employed labour? I sincerely hope I don't. So if it's established that agency workers are less cost effective and all of this comes down to money, well then can I ask why more direct labour is not being employed? It's a much better utilisation of the budgets.
Thank you, Deputy.
What they're saying, if I could, what they're saying is that there is an effective recruitment pause in place.
Thank you. Minister.
No, what they're saying is that the health service has to at least be cognisant of its budget. I'm sure in lots of areas of the public service we need more frontline public service staff. Let's be very clear. I'm aware that the public service went through an extraordinarily difficult time and we need to increase the number of frontline staff. The point I'm making to you is we increased it in 2015. We're increasing it this year. We will increase it further. But if the Garda Commissioner wants 1,000 more Gardaí in the morning, she has to be cognisant of the budget available to her. Equally, our hospitals have to be cognisant of the budget available to them. However, let's be clear, there is exemptions in relation to emergency departments, in relation to critical posts, there's more autonomy at a local level, and this is only relating to the pay budget. This is not to offset any other area of overspend. The agency staff point is a really important one, and let me also be clear, the agency staff post can continue to be converted into permanent posts. So agency staff and conversions is continuing to happen in the health service. It's happening this week, it'll be happening next week, where it's possible to recruit staff. As you know, in certain parts of this country, in certain parts of the health service, it's not always possible to recruit staff. Very final point I would make is, I am not suggesting that there is an adequate number of people in the front line of our health service. We lost about 12,000 posts during the deep recession. We have about 6,000 back back, and I would acknowledge we've much more to do.
Thank you. Deputy.
Activity is increasing though, Minister, so even getting back to the level that they were at before they were decimated isn't going to cut it. You referred to the Garda Commissioner. There was, as you know, carnage and a lot of blood spilt in the North Inner City. Is that what we're waiting for, so that we can get an increase in the budget? She looked for an increase in her budget and she got it. There was 5 million directed towards it. I don't think it's acceptable to say that that staff levels are increasing when clearly they're not keeping up with demand. Activity levels are increasing year on year, month on month, and the staffing levels just aren't keeping track with it. I don't know, Minister, if you talk to frontline staff. I've spoken to nurses, I've spoken to porters, I've spoken to home helps. They're at crisis point now. You know, and they have heard from yourself and people in your government that there's some sort of a recovery underway, and they look around them and they don't see it.
Of course I talk to frontline staff, and nobody in here has an exclusivity on talking to frontline staff. I talk to them regularly, and I continue to talk to them, as will all of us on all sides of the House, I'm sure. And whilst they accept that the economy is recovering because there's more money going into the health service, they would be the first to tell me, and I would be the first to agree, that we've got to do much more to improve our health services. The only reason the last government was able to increase the health budget was because we had the money. You couldn't increase the health budget when the Troika was in town. I find myself in this new position as Minister for Health at a time of reinvestment in our health service, and there is much to reinvest in. The health budget did increase. It will increase again. We will continue to invest in our health service. But we can't fool people out there or try to pretend something to people that isn't simply the case. There are recruitment issues. We have vacant nursing posts that are funded, that could be recruited. We need to attract more nurses. We need to attract more nurses back from the UK. How do you do that? You do it through a variety of means. And I'm talking to nurses on the front line, and I'm talking to nursing organisations. We need to continue to attract consultants into this country. We need to continue to, as you correctly say, convert agency posts to frontline permanent posts. There's a huge job of work to do, but let's not put out the myth here that there is a reduction in numbers or that numbers aren't increasing when the numbers clearly show they are.
Thank you very much, Minister. The final priority question under the name of Deputy Murphy O'Mahony. Minister, your response.
First of all, I want to